So I'm just going to be running through client consultations. So there's two types of consultations. The first consultation is where you find out what the client wants, you have a look at their brows, you can draw on one side if you want to. If you don't have a big portfolio, then it's probably an idea that you draw it on for the client so they can see what they want. And you do a patch test. And then the second consultation is when they're actually in for the treatment, and you'll be going through their paperwork just to make sure there's no contraindications and there's no reason that you can't go ahead with working on them. So you will have 3 bits of paperwork that you need to fill in, and it's really important that you do it every single time, even if the client's been coming for years and years, even if it's a touch-up, even if it's a tiny minor tweak, they have to do it every single time they're in. And what we're going to be doing is going through medical history forms with them. We will be going through treatment consent forms to make sure they're happy with the treatment and they understand the treatment, and we'll also be going through aftercare instructions. So I fill out as much as I possibly can of these forms before they come in, and then the rest I'll do with them. And I make sure that I personally do it with them so that I don't accidentally miss anything off if they're filling it in themselves and I don't spot it. So the first thing that we need is their name, their address, their email address, a current telephone number and a mobile number. So you need to write down, I know it sounds pretty self-explanatory, but you need to write down what style of treatment they're having. And the reason why it's important to write down the exact style is because we charge a different price for every single style. So what you don't want is you've talked about ombre, you've done ombre, but they didn't realise that ombre is £200 more than natural hair strokes or whatever your prices are. But specifically write down, are they having brows, eyes or lips? And if they are, what specific style, and also how much does it cost, so that when it comes to the end and they're paying for the treatment, that there's no confusion because you've written it down in the paperwork. Then also write down the expected number of visits. So if it's always just 2 appointments, then write down 2 appointments. But if you're doing something a bit different, like scar tissue, where it may take 3 or 4, then write down 2 appointments, but potentially 2 others at worst case scenario, where it's a bit of an unknown. So write that down so that there's no confusion over how many times they have to come. And also they'll be signing on this page to say that they agree with the colour and shape that has been chosen, and that you will also be using the measuring calipers, or you can use the string, just to make sure that things are level, because clients do come in with their own designs, but sometimes they're not level. So we just want their permission to be able to tweak things if we see that they're slightly imperfect. Then you'll need to complete a medical history form. So they'll be telling where the doctor's surgery is and if they've had any past or impending medical operations, only within the last 6 months. So they'll be signing to say whether or not they've got any of the following: high or low blood pressure, allergies, pacemaker, heart disease, asthma, diabetes, epilepsy, dermatitis, acne, vitiligo, skin cancer, haemophilia, cold sores, HIV or AIDS, hepatitis. Do they bruise or scar easily? Do they wear contact lenses? Have they had any eye or facial surgery in the last 6 months? Do they have sensitive eyes? Do they have collagen injections? If so, when? Facial peels? If so, when? Medication on a regular basis? Pregnant or breastfeeding? Now, usually on the phone they would tell you if they were pregnant or if they're undergoing chemotherapy or anything like that. But if there's any sort of unknown medical issues, I would always advise them just to give their doctor a quick call and see whether or not it's safe for them to have treatment. But obviously we go through that in training, which treatments are safe to work on. And also double check if they're having their lips done. Do they regularly suffer with cold sores? Because if they do, you'll need to make sure that they treat the cold sores for 5 days before they come in for treatment, so that we don't have an outbreak straight afterwards. Then we'll run through aftercare instructions. So they'll sign that page too, and then we explain to them that the skin will be temporarily sensitive for the next few days following treatment, and that's all quite normal. And then I verbally explain to them not to put makeup on the treated area for the next 5 days after treatment, to cleanse the area just with water and a clean cotton bud, to apply vitamin A and D cream, which we give to them free of charge, 3 times a day for the next 5 days, apart from on the eyes, which we just leave to dry heal. I explained that the healing of the treatment will take up to a week, and it's perfectly normal for there to be a very small scabbing on the area, which will fall off within the next few days, and to not touch it or pick it. And it's also normal for the colour to fade by up to 70% within the first treatment. Also, I'll tell them to avoid touching the area with their fingers, to avoid soaps, cleansers, creams or makeup for the next few days, to avoid any heat treatments on the face for the next 5 days, any abrasive products such as rough towels or similar. Don't be scratching at their eyebrows. Do not pick the small scabs, as tempting as it is because it gets a bit itchy. It's important not to, because you will pull away the colour. And also avoid things like saunas, steam room. Keep the area as dry as possible during the healing process. Exposure to sun or chlorine over the next few days, and any form of bleach or hair removal products around the treated area. And then I get them to sign their name, and then I will countersign it just below. That has to be done every single time with every client. And you also need to store it in a lockable cabinet for the next 3 years.